Today I want to talk about two blood pressure medications that you have been taking every day. Maybe they have been part of your daily routine for a year, maybe for 10 years. Maybe your doctor just started you on them last month and you are still getting used to the idea that you are now someone who takes blood pressure medication. Every day, the names on the bottles are Amlodipine and Losartan. You may not have thought much about them. They are just the pills that keep your blood pressure under control. The pharmacist hands them to you each month. The doctor checks the numbers at your visits and you swallow them with your morning coffee or with a glass of water. And move on with your day. I want to take a few minutes today and walk you through what these two medications actually are, what they do inside your body, what side effects to watch for, and the specific things every senior taking them should know, but is rarely told clearly. By the end of this conversation, you will understand your own medications better than most people ever do, and you will have a clearer sense of what to bring up with your doctor at your next visit. My name is Dr. Cynthia Adeyemi, and this is one of the more practical conversations we will have together. Stay with me because what you learn here may genuinely change how you take care of yourself. Let me start with what you should understand before anything else. Amlodipine and Losartan are two of the most widely prescribed blood pressure medications in the world. They are commonly used together, often as a single combination pill, because they work through different mechanisms and their effects complement each other for many seniors. With high blood pressure, this combination is a reasonable choice that controls blood pressure effectively while generally avoiding some of the more burdensome side effects of older medications. I want to say clearly before we go any further that I am not telling you to stop these medications. High blood pressure in older adults is one of the most important conditions to control because uncontrolled blood pressure leads to strokes, heart attacks, kidney disease, dementia, and many other serious problems. The medications you have been prescribed are doing important work, and stopping them without guidance can be dangerous. What I am telling you is that there are specific things to know about each of these medications, particularly for seniors, that will help you take them more safely and more effectively. Some of these things may surprise you. Some of them are conversations that I hope you will bring to your doctor at your next visit. Let me walk you through each medication in turn. Amlodipine is a medication in a class called calcium channel blockers. You may have heard of others in the same class, including nifedipine, filine, and duloxetine. Calcium channel blockers work by relaxing the smooth muscle in the walls of blood vessels. When the blood vessels relax and widen, blood can flow through them with less resistance and blood pressure drops. This is a different mechanism than many other blood pressure medications, and it makes calcium channel blockers particularly useful for certain patients, including many older adults. Amlodipine has several advantages that make it a popular choice in seniors. It is taken once a day, which simplifies medication routines. It has a long duration of action, which means missed doses are slightly more forgiving than with shorter-acting medications. It does not generally cause the cough that some other blood pressure medications can cause, and for many patients it works reliably and predictably. But there are specific side effects and considerations every senior taking amlodipine should know. The most common side effect is swelling in the ankles and lower legs. This is called peripheral edema, and it happens because amlodipine causes the small blood vessels in the legs to relax in ways that allow fluid to leak into the surrounding tissues. The swelling is usually worse by the end of the day, often less noticeable in the morning, and can range from mild puffiness to significant swelling that makes shoes feel tight. I want to be specific about this because it is one of the most underdiagnosed effects of this medication. Many patients on amlodipine develop ankle swelling, and either do not connect it to the medication or assume there is nothing to be done about it. The reality is that the swelling is dose-related, often improves with a lower dose, and sometimes resolves entirely when the patient is switched to a different class of medication. If you have noticeable ankle swelling and you are on amlodipine, please bring this up with your doctor. Sometimes the answer is a dose adjustment. Sometimes it is the addition of another medication that counteracts the swelling. Sometimes it is a switch to a different medication entirely. There are options. The second common side effect is flushing and a feeling of warmth, particularly in the face. Some patients also experience mild headaches, particularly when first starting the medication or after a dose increase. These effects usually improve within a few weeks as the body adjusts. The third effect is dizziness, particularly when standing up quickly. This is called orthostatic hypotension, and it happens because the blood vessels are relaxed and blood pressure drops temporarily when you change position. For seniors, this is one of the most important effects to understand because the dizziness can lead to falls. And falls in older adults can be genuinely dangerous. We will come back to this in detail in a moment. The fourth effect, which is less commonly discussed, is gum problems. Amlodipine and other calcium channel blockers can occasionally cause overgrowth of the gum tissue, particularly in people with poor oral hygiene, if you notice changes In your gums while on Amlodipine, please mention it to both your doctor and your dentist. The fifth effect is constipation in some patients, which is more common with the calcium channel blocker class generally. Amlodipine is generally considered safe for older adults and does not require dose adjustment for age alone in most cases. It does not significantly affect sexual function the way some other blood pressure medications do, which is one of its advantages. It does not generally cause the metabolic problems that thiazide diuretics can cause, including blood sugar changes, and it does not cause the fatigue that beta blockers often produce. For these reasons, Amlodipine is often well tolerated in seniors, but the specific effects I have described deserve your attention, particularly the ankle swelling and the dizziness on standing. Now let me walk through Losartan. Losartan is a medication in a class called angiotensin receptor blockers, often abbreviated as ARBs. You may have heard of others in the same class, including Valsartan, Irbecartan, Telmisartan, and Olmesartan. Losartan works by blocking the action of a substance in your body called angiotensin, to which normally constricts blood vessels and causes the kidneys to retain sodium and water. By blocking this substance, Losartan allows blood vessels to relax and helps the kidneys excrete sodium more efficiently. The result is lower blood pressure. Losartan has several features that make it particularly useful in seniors. It is generally well tolerated. The most common side effects are mild and often improve over time. It does not typically cause the cough that ACE inhibitors can cause. It does not significantly affect mood, cognitive function, or sexual function in the way that some other classes of blood pressure medications can, and it has specific protective effects on the kidneys, which is important for many older adults who have some degree of age-related kidney decline or diabetic kidney disease. But Losartan also has specific considerations every senior taking it should know. The first consideration involves potassium. Losartan, like other ARBs, can cause potassium levels in the blood to rise. For most patients, this is a small effect that does not cause problems, but for seniors who may have some degree of kidney decline, who may be taking other medications that also raise potassium, or who may have diabetes or other conditions that affect potassium balance, this effect can become significant. High potassium in the blood can affect the heart in dangerous ways, including causing irregular heart rhythms. This is why patients on Losartan should have their potassium levels checked regularly, particularly when starting the medication, when the dose is changed, and periodically thereafter. If you have been on Losartan for a long time and have not had your potassium and kidney function checked recently, this is something to mention to your doctor. Be aware of foods very high in potassium if you are on Losartan. This does not mean you need to avoid them entirely, but you should be aware that bananas, oranges, tomatoes, potatoes, avocados, beans, leafy greens, and certain salt substitutes that use potassium chloride can all contribute to higher potassium levels in your blood. For most patients, normal consumption is fine, but if your doctor has told you to watch your potassium, please follow that guidance. The second consideration involves kidney function. Losartan affects how the kidneys handle blood flow. For most patients, this is actually protective and beneficial, but in some situations, particularly in patients with significant narrowing of the kidney arteries, certain types of severe heart failure, or significant dehydration, Losartan can occasionally cause kidney function to worsen. This is why your kidney function should be monitored through blood tests, particularly when the medication is started or when the dose is changed. If you ever experience significant illness with vomiting, diarrhea, or reduced fluid intake while on Losartan, please contact your doctor. In these situations, the medication may need to be temporarily held to protect your kidneys. The third consideration involves blood pressure that can drop to low, particularly when first starting the medication or after a dose increase. This connects to the dizziness on standing that I mentioned with Amlodipine, and we will get to that in a moment. The fourth consideration is that Losartan should not be used during pregnancy. Because of risks to the developing baby, for senior patients this is usually not relevant, but I mention it because some women who can still become pregnant continue to be prescribed these medications, and the warning is important. The fifth consideration is that Losartan, like all ARBs, can occasionally cause mild dizziness, fatigue, or headache, particularly when first starting. These effects usually improve over time. Now let me talk about something that applies to both medications together and that I think is one of the most important things for seniors to understand. When Amlodipine and Losartan are used together, particularly at higher doses, they can cause blood pressure to drop more than expected, especially when you change positions. This is the phenomenon called orthostatic hypotension, where blood pressure drops when you stand up from sitting or lying down. For seniors, this is one of the most underappreciated risks of blood pressure medication, the dizziness that comes from a brief drop In blood pressure when standing up can lead to falls. Falls in older adults are one of the most serious medical events I see in my practice. They can result in broken hips, head injuries, prolonged hospitalizations, and a cascade of decline that some patients never fully recover from. The challenge is that the symptoms of orthostatic hypotension can be subtle. You stand up, you feel a brief dizziness that lasts only seconds. You think nothing of it. You go about your day. And then one morning, that same brief dizziness becomes a fall with consequences that change your life. Here is what every senior on blood pressure medication should know about preventing this. When you stand up from sitting or lying down, do it slowly. Sit on the edge of the bed for a moment before standing. Put your hand on something stable as you rise. Wait a few seconds before walking. These small habits practiced consistently dramatically reduce the risk of falls related to position changes. Be particularly careful in the morning. Blood pressure tends to be lowest in the morning, and getting out of bed too quickly is one of the most common scenarios for falls in seniors. Stay well hydrated. Dehydration worsens the drop in blood pressure that can occur on standing. We have talked in other conversations about the importance of hydration, and this is one of the specific reasons it matters for seniors on blood pressure medications. Be careful with hot showers and hot environments. Heat causes blood vessels to dilate, which can worsen the drop in blood pressure when combined with medications that are already relaxing the vessels. Sitting after a hot shower for a moment before standing is a small habit that prevents real problems. Be aware that alcohol can interact with these medications to cause more pronounced drops in blood pressure. If you drink, please do so in moderation and be especially careful with position changes afterward. If you experience significant dizziness on standing, falls, or near falls, please tell your doctor. Sometimes the answer is a medication adjustment, sometimes it is a change in timing, sometimes it is the addition of specific recommendations for fluid intake or position changes. The conversation is worth having, and the prevention of falls is one of the most important things we can do for seniors on these medications. Let me also walk through a few specific things to monitor and to know while taking these medications. Have your blood pressure checked regularly at home if you can. A simple automated home blood pressure monitor is inexpensive and one of the most valuable tools for managing high blood pressure. Check your blood pressure at the same time each day, sitting quietly for a few minutes before measuring with your arm supported at heart level. Keep a log to share with your doctor. Know your target blood pressure. For most seniors, the target is somewhere around 130/80, though this varies based on individual factors. If your readings are consistently far above or far below your target, this is information to share with your doctor. Be aware of symptoms that suggest your blood pressure is too low. These include dizziness, lightheadedness, fatigue, blurred vision, and the orthostatic symptoms I have described. If these are persistent, your medication may need adjustment. Have your blood work checked as your doctor recommends. For Losartan, particularly, periodic checks of kidney function and potassium are important. For both medications, periodic checks make sure that your overall health remains stable. Take your medications at the same time each day as consistently as possible. Both Amlodipine and Losartan work best when taken regularly. Missing doses occasionally is not a disaster, but a consistent routine produces the best blood pressure control. If you miss a dose, take it as soon as you remember, unless it is close to the time for your next dose. In that case, just take the next dose at its usual time. Do not double up doses to make up for a missed one. Be aware of interactions with other medications. Both Amlodipine and Losartan can interact with various other medications, including some over-the-counter pain relievers, certain antibiotics, and some heart medications. Whenever a new medication is added to your routine, including over-the-counter products and supplements, make sure your pharmacist or doctor reviews it for interactions with your blood pressure medications. Do not stop these medications suddenly without medical guidance. While these are not the medications where sudden discontinuation is most dangerous, abruptly stopping can still cause blood pressure to rise rapidly and is best done with medical supervision. I want to take a moment to talk about some special situations that seniors taking these medications should know about. If you become significantly ill with vomiting, diarrhea, or reduced ability to eat and drink, your blood pressure may drop too low and your kidneys may be affected by Losartan. Please contact your doctor when this happens. Sometimes the medications need to be temporarily held until you recover. If you are scheduled for surgery, please make sure your surgeon and anesthesiologist know all the medications you are taking, including these. They may give specific instructions about whether to take your medications on the morning of surgery. If you are starting a new exercise routine, this is good for your blood pressure and overall health, but be aware that significant changes in physical activity can affect how much medication you need. Discuss this with your doctor, particularly if your blood pressure has been well controlled and you are making significant lifestyle changes. If you experience any significant new symptoms while on these medications, including persistent cough, severe ankle swelling, palpitations, fainting, significant changes in urination, or unusual fatigue, please report them to your doctor. While most side effects of these medications are mild, occasionally more significant issues develop that need attention. I want to take a moment to be honest about something important. These medications work for the right patients. Used appropriately, they significantly reduce the risk of strokes, heart attacks, and other serious cardiovascular events. Older adults who have their blood pressure well controlled have measurably better outcomes across many dimensions of health than those whose pressure is uncontrolled. The side effects I have described are not reasons to refuse these medications. They are reasons to take them thoughtfully, to monitor yourself, to communicate with your doctor, and to make adjustments when needed. Most patients on Amlodipine and Losartan tolerate them well over many years and benefit substantially from the protection they provide. What I want you to leave this conversation with is not fear but informed partnership with your own medical care, knowing what your medications do, knowing what to watch for, knowing what to bring up at your next visit, knowing what is reasonable to expect, and what deserves more attention. This kind of informed engagement is one of the most important things a senior can bring to the management of their own health. Has anyone in your life ever walked you through the specifics of your blood pressure medications the way we have today? Has anyone explained the side effects to watch for, the things to do to take them more safely, and the conversations to have with your doctor? For most patients, the answer is no medications are prescribed. The pharmacist hands them over with a brief note and the deeper conversation rarely happens. If this has helped you, share it with someone in your life who would benefit. A parent, a spouse, a friend who has been taking these medications for years without ever having had this kind of conversation. The information matters most when it travels to the people who can use it, and tell me in the comments. Tell me which medications you are taking. Tell me which of the side effects you have experienced. Tell me what questions you still have. Tell me what you are going to bring to your next doctor's appointment. After watching this, the community in those comments helps more people than you may realize. Before I let you go, one final thought. The medications you take every day are not just chemicals. They are tools that have been developed over decades to extend your life, to protect your organs, to keep you well enough to do the things you love with the people you love for as long as possible. They are remarkable tools, and they have given millions of seniors years they would otherwise not have had, but like all tools, they work best when you understand them, when you use them thoughtfully, and when you stay in conversation with the professionals who help you wield them. The relationship between you and your medications is meant to be active, not passive. You are not just a recipient of prescriptions. You are a partner in your own care. Take the small steps that I have described today. Watch for the side effects that matter. Make the appointment if something has been bothering you. Bring the questions to your doctor. Have your blood pressure checked. Have your blood work monitored. Be careful about how you stand up in the morning. Stay hydrated. Communicate openly with the people taking care of you. These small acts of attention are how you partner with the medications that are working to keep you well, and the years they help you live are worth every bit of that attention. Everything I have shared with you today is for educational purposes, to help you understand two of the most commonly prescribed blood pressure medications and to give you a clearer sense of what to discuss with your doctor. Every patient is different, and the right approach for you depends on your individual medical history, your other conditions, and many factors that only your own physician can evaluate. Please do not stop, change, or adjust your medications based on this video. The path forward is conversation with your doctor or pharmacist, not unilateral action. If you experience any sudden or severe symptoms, including chest pain, severe shortness of breath, signs of stroke, severe dizziness or fainting, or significant changes in your blood pressure readings, please seek medical care promptly. If you have specific concerns about your medications, please bring them to your next medical visit. Most physicians and pharmacists welcome the opportunity to discuss medications with engaged, informed patients, and the conversation is one of the most valuable parts of your medical care. You are not a chart. You are not a list of prescriptions. You are a human being whose health, comfort, and quality of life matter as much as the numbers on your blood pressure cuff. The medications you take are in service of that fuller picture, and the more thoughtfully you engage with them, the better they can serve you. Thank you for spending this time with me. Thank you for caring enough about your own health to learn what is in those small bottles in your medicine cabinet. And thank you most of all for being the kind of person who takes seriously the responsibility of being an informed partner in your own care, because that informed partnership is one of the most important things you bring to the work of staying well into your later years. Take care of yourself, take your medications thoughtfully, and I will see you next.